There was definitely some physical issues. I was having neck pain and numbness down my right arm. I think I always knew I wanted something outside of the operatory. And that was kind of a risky move because it was a temporary position, but I really wanted that change. I'm really happy that I took that little leap. I have a large department, all doctors, and I think I'm the only person who's not a doctor. I've definitely battled with the imposter syndrome.
You're teaching such a powerful component of the identifying the risk profile of the patient, because in schools we teach that, but when we are out in private practice, a lot of times we lose that piece and everyone's treated the same, and it hurts my heart when I see that. Hey everybody, welcome to the Dental Handoff. I'm Dr. Kelly Tanner, and today I have with me a hygienist who has a very unique path, Tiffany Bairos. Tiffany, thank you so much for being on.
Thank you so much for having me. I'm excited to be here.
Yeah, I know you have such a cool trajectory in what you were doing. And before we got on, we were talking about where you work right now. And I'm like, wait a minute, how is that possible? Because the position that you have, and it was kind of like the timing with the opportunity. So before we get into all that, tell me why dentistry for you.
Yeah, sometimes I think kind of dentistry chose me because I kind of started with I was in school, I was in Northeastern, I was in their open option program, I believe it was called, and basically you knew you wanted to be in healthcare, but you weren't sure exactly the path. Um, my cousin got me a job working the front desk at a dental office, and I was terrible at that, but that's okay. I was afraid to ask anyone for money, but so then at Northeastern, they had a co-op program where you would work for like a semester or two every year. I ended up applying at a dental office, and they just hired me basically because I knew my tooth numbers and what surfaces of the teeth they were. Um, kind of, got into that, and the dentists were always kind of saying like, "Oh, you should be a hygienist, you should be a hygienist," and it sounded like a great career. So then I applied to hygiene school and started right away. So
Did you go right into clinical or did you do something else?
Yeah, no, I went right into clinical hygiene. I did that for about 18 years. And then it kind of started to get burnt out at that point. But yeah, I worked for about 18 years in clinical practice, mostly GP and a little bit in pedo.
So then after that, like in the meantime, tell us what you did, what you learned, all the good stuff.
Yeah.
What do you think caused your burnout?
There was definitely some physical issues. I was having like neck pain and you know, kind of numbness down my right arm and things like that. And I think it was just I think I always knew I wanted something outside of the operatory as well. I enjoyed hygiene. I really liked building relationships with my patients and things like that, and kind of the flexibility of being able to work, close to home, and being able to work part-time while I was raising my kids and things like that was great. And then kind of when my kids got older, and I think my body had had enough, and I kind of was looking for something outside of the operatory. Yeah.
So then that you went at that point, what did you do? Did you take a bit of time off? Did you
Yeah, so I kind of thought that I might be interested in research. So I had a patient, she was a nurse, and she worked as a clinical research associate. She told me about a certificate program at Boston College for healthcare professionals that were looking into research. So I ended up taking that. It was, a quick certificate program that taught me a lot about kind of the guidelines and regulations behind clinical research. And then I started a temp job. So I was still working as a hygienist. I started a temp job at a company close to home that was doing ophthalmic studies. And they hired me because, as a hygienist, basically they ran their studies like almost like everybody got one job. So like an assembly line type of a thing. So they needed someone to do medical history. I'm like, I can do medical histories, right? So that was my job. I would be part of the research study, but I would just take medical histories. So I did that for a little bit, and then I ended up applying for a job as a clinical research coordinator at a dental school doing their clinical studies. So I kind of had the hygiene background and then that research education and a little bit of research experience. So that was great. And I really enjoyed the research position because there's different studies going on all the time, different procedures. And I was, maybe some studies I might be taking x-rays, maybe sometimes I'm doing a prophy or doing, saliva samples or something like that. So it's kind of a little, different every day. And I was still kind of getting that interaction with the participants in the research studies. And, you know, you still like, you miss those relationships, right? When you like having that with your patients. So I did that for a few years, and then I was able to get my master's in public health while I was in that role. And then it kind of just worked out that um, in the school I'm working at, there was a hygienist that was retiring, and she was teaching Caries risk assessment to the dental students, and they were looking for a hygienist with a master's degree. I literally just graduated with my master's degree, and applied for that position, and kind of just went right into that. So yes, I teach the dental students about Caries risk assessment and kind of preventative dentistry.
Okay, so you just said a lot there
Yeah.
because that was quite cool. So you stopped clinical practice and then you worked for doing research with a ophthalmic optometry group or
Yeah.
something where you were just doing one part, the medical history. How long did you do that?
Well, maybe about a year, but it was just temping, so, it might be like a couple of days a month or something like that, but
I gotcha. Okay. What did you learn about yourself in that time?
yeah, I guess just it was nice to learn something new. It was nice to just kind of dive in. I liked that every study was different and kind of interesting, and just seeing, the breakdown of what exactly you're looking for in these studies and what they're researching. And so I really enjoyed that. And it was just, I realized that kind of just getting a little bit of experience in something really makes you kind of not only lets you know if you enjoy that or if you're cut out for that, but it also kind of, makes you more attractive as a candidate to some other role so that you can kind of move forward there.
Because then during that, you realized, I guess, that you really liked the research aspect of it. So
Yes.
that's when you made application to the next thing. Did you search these things out or did they come to you?
But I did search it out. I did apply to the dental school. Probably from a job board or something like that. But yeah, and that was kind of a risky move for me, I guess, because it was at first it was a temporary position and they weren't sure if it was going to be permanent. It was full time. I hadn't worked full time in 20 years or something, right? I was, working part time raising kids, and I'm like, oh, 9 to 5, Monday through Friday, huh? And a commute and all this stuff. And so, but I really wanted that change, and I kind of took a little leap of faith there, and it worked out really really great because then I was able to get my master's degree. And yeah, I'm really happy that I took that little leap.
Yeah. Did you feel like at any point that because of a lot is something that people talk about a lot is like that imposter syndrome, like, am I
Mhm.
ready to do that? Am I qualified to apply for this position? Not that you weren't, obviously you were, but when you go outside of what you're used to, I mean, you did the other research study, so there was like a common thread there, but it was like, am I qualified to do this? Did you run across that in your internal self? Do you remember?
Yes, for the research position, they were so happy that I was a hygienist that they really gave me a lot of confidence actually, and made me feel really good. So that they definitely were like super supportive and were like so happy that I could, kind of answer these questions, and I knew what to do and everything. And I remember like the first day we saw a research subject, and there's a dental clinic there, and the coordinator that was training me, I think she wasn't a hygienist or assistant, but that was, just the role. And she kind of turned around and said, okay, and now we clean the chair. And I had already had the chair cleaned, and it was like 30 seconds, right? She was like, oh, okay. And I was like, I'm used to being,
Yeah.
I like 10 seconds for this. But yeah, right. And she was just like, oh, okay, I think you get that. But but yeah, but moving on to a faculty position, for sure, 100% imposter syndrome. You know, I'm I have a very large department, all doctors, mostly dentists, and PhDs, and I think I'm the only person who's not a doctor. So for sure, I've definitely battled with the imposter syndrome.
So it's you. Okay, so then the research is just stepping back to that. How long
Mhm.
were you in that?
So 4 years.
Okay.
Yeah.
And then so you left because you saw this opportunity where you are now?
Yeah. So it just kind of same school, so it just kind of transitioned there. And yeah, it worked out. And then I still do some research, so I still kind of get to do that as well.
Yeah, because we were talking before we got on that when I worked at a dental school in Virginia, it's very much like you are Y well, you're a full-time
Mhm.
employee of there, and
Yes.
your job is very specific, teaching Canberra to the dental students and working alongside with the students and working through telehealth to teach them how to do that. So and you guys don't have a hygiene department, do you? It's a dental.
Yeah. Yeah, it's just a dental school. Yeah.
Do people ever ask you why you're not a dentist?
Not in this role, but as a clinician all the time. Yeah. Yeah, are you going to be a dentist next, or do you want to be a dentist or something? But yeah, no. I do like that. Um, just I feel like it's good for the dental students too to kind of have that hygienist that, sometimes they don't hygienists and dentists don't dental students don't work that much together. So I think it's nice. Sometimes they really appreciate that we're just focusing on prevention while they're with me, and just kind of taking a step back and thinking about, how we putting this patient at risk for decay, how can we prevent this from going forward. I tell them, if you can, you're protecting your work here. You're doing all this work on a patient, you're doing these restorations, they paid a lot of money for this. And if you can show them how to prevent caries, prevent that recurrent decay, they're going to think you're a superstar, right? Because you're protecting your own work, really.
Yeah, I went where I taught, there was a that was part of the dental school, but we had a hygiene program. And so it's a unique position to be in that you're in because you're very specific to what you teach and there's not
Oh,
a hygiene program. But the we used to have the dental students used to rotate through hygiene for their recare. It's kind of like their internship where they see like an X amount of number of recare patients that semester. And they all said to me at the end of this, they said, let me tell you something. I'm going to hire a hygienist. I don't wanna do this. I'm like, "This is good. This is good." And there's so much that we focus on that, you stay in your I mean, not that we don't all care about it because we do, but you get to stay in your lane of restoring. We can prevent, we can work together to prevent, but there really is that differentiation in what we do. But you also are working through telehealth. Tell us about how that works and the patient interactions with telehealth.
yeah. So the person that was in this role before me, I believe, started this kind of during COVID. So when the students do this competency exam where they're educating their patient on how to prevent caries and their risk and their recommendations, we do it over a telehealth appointment. So that way, the student is setting this up. They have to learn how to create a HIPAA compliant meeting and, the regulations and everything about the telehealth appointment. So, the hope is that giving them a little bit of experience with this is maybe something that they'll think about, and maybe they can figure out how to incorporate this in their practice in some way. And usually they kind of say, oh, I was really nervous, and I'm not like this when I'm face to face with my patient. And, this is like awkward. And I'm like, yeah, that's why we do it, right? We're all used to being face to face with our patient, but it's good to kind of give you a little taste of this, and just so you know what to expect and things like that, because it could be really useful in your practice.
Sure. And how does it work I mean, I know that you're working through telehealth. So these already existing patients of
Yes.
dental
Yeah.
Okay,
Yeah.
so they are working with them through telehealth. And then what does that visit sound like? Because you're very specific to Canberra. So like What does that sound like when they're talking
Yes.
to them? How does that work?
So basically, I'm just kind of observing, and the student is just kind of educating the patient. So they'll go through and say, this is how you get, this is how caries develop, and we did a caries risk assessment on you, and you're high risk because maybe you're snacking 3 times a day, or you have xerostomia or something like that. And then they'll go through and um, give all their recommendations. Usually they throw up the Steffens curve, right? And say, okay, this is what happens when you have sugar or carbohydrates. Give their recommendations for fluoride and diet, oral hygiene, and that sort of thing. And we want them to focus on their patient centered communication skills and asking open ended questions and things like that so they can really tailor the recommendations for that patient, and ask about any barriers to their recommendations and things like that. Yeah, pretty much.
Yeah,
Yep.
usually not that they, they're obviously learning how to do it, but they're understanding that interaction that we're having as well. And you're teaching such a powerful component of the identifying the risk profile of the patient, because in schools we teach that, but when we are out in private practice, a lot of times we lose that piece and everyone's treated the same. And it hurts my heart when I see that. I'm like, wait, back up. The medical history part. Did you take the did you read through the medical and see all the different risk profiles that could lay on top of that? But it's an important piece, and sometimes when you're in school, I know those of you all who are listening who went through these rigorous programs, it seems all very abstract when you're learning it. But then it's like that aha later on in life. It's like, "That's why we learned it. Oh, yeah."
Yeah. Yep. Absolutely. And you'll be surprised. I'm always like, you'll be surprised if you ask, your patient something like it's sometimes it's not what you expect, or, sometimes it's, you're asking about the patient's diet, but maybe and maybe it sounds okay, and you're like, why are they getting all these cavities? But maybe they're not telling you that they eat Tic-Tacs all day or something. So you got to just kind of, ask another question, and kind of get to the root cause of what's going on.
'Cause sometimes when they say the second thing, you're like, "Wait, what? Say that again?"
Yeah,
I didn't get it the
absolutely.
first time.
Exactly.
Time you're allergic to what?
Yeah.
That happen?
Yeah, absolutely.
So then, of course, with what you're doing and what we were talking about, you're very interested in helping teams with working together with culture. Tell us a little bit more about where that comes from in your hearts,
Yeah.
because I think that that's where a lot of that work is. And, yeah, tell them what you're developing and what you're thinking.
Yeah, so I'm working on a course for kind of for dental practice owners. I know I work with a lot of dentists. I work with hygienists, with the Mass Dental Hygiene Association, and I know there's dentists are having a hard time recruiting hygienists right now. And I feel like sometimes there's some miscommunication there between hygienists and dentists, and so I'm working to develop a course, and doing some coaching with dental practice owners to kind of help them really position their practice to attract and retain really quality hygienists that are a good fit for their office. So things like good workplace culture, good leadership, and just creating systems that keep everybody kind of healthy, and good ergonomics, and just a healthy environment so everybody can work to their full potential, work to the full scope of their license, and grow, and just be happy and really want to stay with their office, and really contribute.
Yeah, with
Yeah.
the I know that you said that you were in clinical for quite some years, and then you got burnout mostly due to physical fatigue and some other things that you're having. What are some things that you've experienced that you said, "Oh, this really works for culture," or "This is something that really could work better"? What are some things that you would say or get advice that you would give to our listeners?
Yeah. I mean, I've definitely, yeah, I've experienced a lot of different things working practices over the years, but yeah, sometimes just, asking the employees like what they want out of, their career and trying to, like, just treat them more as individuals. Um, some things are more important to other people. Some people might want a leadership position. Some people want more responsibilities, and other people not so much. So I think it's important to kind of get that feedback from your team members and try to just support them, and some people, some hygienists might want to take a course in, whatever it is, laser or something like that, and just kind of being supportive of that, giving them the time off if they need that. And just letting them, I guess, empowering them and trusting them to kind of to do that if they want to start practicing, new technologies or whatever it is. I think that's important.
Yeah, and, a lot of us think that it's something that we just walk into, but it's also a attitude and a belief that we also bring to the table. So it's not always just on the practice, it's about how you're bringing yourself to that to be a part of that culture. And if you are experiencing it in a different way, what do you do? How do you interact with that?
And there's so many different things people might be interested right now. There's the myofunctional therapy, or, maybe somebody's really interested in nutrition or new technologies or whatever it is. So, and that's really can only be a benefit to the practice, it's just supporting someone to kind of follow their interests and contribute in that way.
Yeah. Did you experience some of this where it wasn't as ideal and while you were practicing? And tell us a little bit more about what happened in your practices, if you don't mind sharing. I guess I'm being nosy, but I'm just wondering, like, you were in it for what you said 18 years.
Yeah.
And so you were in it and, there's a lot of experience in there. And there's a lot of different team members that come and go. And that time and practices may have and even, outside of the clinical setting, all the different roles that you've held, it's all about the culture and, like, being a part of the we. So, what are
Mhm.
some things that a doctor could do or a team, let's just say team, like, each individual member, because it falls on all of us when we're part of a culture. In your opinion, like, what are some, like, 3 things that a team member could do to make sure they're holding space for the other team, with holding that culture?
Yeah, I think I mean it's important to just be respectful of everybody else. Sometimes not everybody's there's like favoritism, right? And then, well, why does she get to do this and I didn't get to do that, and things like that can really be detrimental to a practice. So I think, fairness and just respecting everybody is important. um yeah, I think just, the gossip is tough, just if we can kind of quell that. And sometimes that can start at the top, and everybody is kind of looking for the leaders of the practice, and, of to show them what's acceptable. So if you have kind of the leaders of the practice, complaining about the other team members and things like that, that can kind of snowball and create problems. So I think just, doing your best not to gossip, not to complain, and just treating everybody respectfully. And we're all different. We're all going to have quirks. We maybe not every personality is going to work with every personality, but just, respecting that, for respecting everyone for their strengths, and just, yeah, I it's important, I think, to really be a good leader and show how you want people to act, basically.
Yeah, it's to demonstrate that and to hold that vibe. Also, too, I think that it's pretty common in anywhere that we work, whether it's clinical or whether you're a myofunctional therapist or whether you're a dentist listening or an assistant, that we always have a human tendency to think that we do more than the other person. And we really don't know someone else's day. So if we take time to understand that and their stresses and to understand their role and what they're experiencing, that is a part of respect. And because a lot of us, just like many dentists don't learn how to be business owners, many of us don't learn how to communicate with each
Mhm.
other, especially when we disagree, because it's so easy to disagree, shut down, and walk away.
Yeah. Yep. Absolutely. Mm.
Well, if you all want to get in touch with Tiffany, Tiffany, thank you so much for being on today. Her information is in the show notes below, and you can get in touch with her there. And if you're on Apple Podcasts, please go on over to Apple and give the dental handoff a 5-star rating, because the Apple Podcast is the one that's highly rated. And if you're watching this on YouTube, please put in a little comment section, put like a little note, like a little love note, and subscribe to the channel so the algorithm knows that you love us, and we know that you love us because we're increasing our subscriber and taking up more space in this universe. So, um, thank you, Tiffany, again for being on today.
Thank you so much. I
Well,
appreciate it.
thank you for all that you've done and your different journey and how you're impacting the future of dentistry. That's awesome. And to everyone listening, thank you for all that you do and for touching the lives that you do. We will see you again next week. And be well, my friends. Thank you, Tiffany.